Hello there. Today I'm going to talk to you about psychiatry and those who study it, psychiatrists. We all have some sort of mental illness once in a while, such as depression or anxiety. Some of us even have such things as schizophrenia and the like. Well, for those who have depression and anxiety, they usually seek out what we most commonly refer to as counselors, which are usually psychologists, and then there are psychiatrists. Psychiatrists also study the human mind just as psychologists, except they have a medical degree in the study of the human brain and such. Psychologists are also vastly knowledgeable about how our mind works and such, but they do not have the medical background that psychiatrists have and that you must have in order to learn psychiatry. And this is mostly the biggest difference in psychologists and a psychiatrist. I will talk about this further as we move along.
Before I get started, I'd like to introduce a friend of mine. You may have heard of him. He's kind of popular. Born Sigismund Shlomo Freud, you may know of him as Dr. Freud or simply Sigmund Freud. You're probably wondering what the Sigmund Freud guy has to do with psychiatry and why it's so important. Thankfully, I'm going to answer these questions for you. I suppose I should start with the basics. Born May 6, 1856, Freud was considered to be the most intelligent of his mother and father's, Emily and Jacob's, 8 children. Due to his remarkable intellect, the family tended to do all they could to get Freud a great education. This was somewhat problematic, however, as they were a poor family. When Freud graduated high school in 1873, he was considered a fantastic student. While attending the University of Vienna in 1874, he befriended Ernest William von Bruch. Because of this, Freud took some of Bruch's physiology theories. This is where his idea for dynamic psychology came from. In 1879, Freud was forced to serve his 1 year of military service, putting his education on pause. He then received his MD in 1881. To get to the point, Freud was the one to start psychoanalysis, which is that of bringing repressed feelings to be known and understood. This is the ultimate basis of psychiatry and psychology. Freud was also the one to initially bring up the idea that dreams are in fact repressed thoughts. This philosophy is widely used in modern-day psychiatry and psychology. Freud's main theories, in fact, are mostly based on the unconscious mind's activity and the way it worked. These facts being said, Freud was an essential part in psychiatry, psychology, and generally understanding the human mind, conscious or unconscious.
As stated earlier, the only difference between a psychiatrist and a psychologist is that the former is a medical doctor. Psychiatrists and psychologists both alike study and treat mental illnesses through the biomedical view of things. If they wish, psychiatrists can train to be able to do psychotherapy, psychoanalysis, and cognitive behavioral therapy.
Now, you're probably asking yourself, what exactly is psychotherapy and cognitive behavioral therapy? Well, once again, I'm here to answer your questions. Psychotherapy is actually quite simple to understand. Essentially, it is the act of making one feel more comfortable about themselves and what they have and such, and more happy and content with their lives through means of communications and dialogue and mostly human interaction. It's what psychologists and psychiatrists practice the most, and it is in fact what they are most known for, and stereotypically that is usually what they do. Cognitive behavioral therapy is actually a little more complex than that, but still quite easy to understand. It is actually a type of psychotherapy, and it is a goal-oriented, systematic therapy. It makes one change the way they think about themselves, and it's generally successful. It's quite remarkable, as most patients and clients of the psychiatrist usually end up even better than when they went in.
Another way that psychiatrists can make their job more unique is through one of the several subspecialties that they can choose from. For example, and most common, is a child and adult psychotherapy. I will now talk about this more.
Almost everyone can agree that children are going to be our future, and child and adolescent therapy is perfect for this, as it is a therapy dealing with children, adolescents, and their families to deal with their issues and their mental problems to make sure their life it will be alright.
Education and other requirements tend to vary. Generally, one must finish their bachelor's degree. Then, they must enroll at a medical school for 4 years to become a certified medical doctor. Still not a fully licensed psychiatrist, they must practice as a psychiatrist resident for 4 years. Afterwards, they take several written and oral exams. Altogether, it is typically around 12 years to become fully licensed. Quite an amount of time.
Question is all this time and money for school really worth it? Well, now we're going to look in to see just how much money these psychiatrists make. To start, the national average for entry wage payment for a psychiatrist, $50 an hour. That racks into just over $100,000 a year, and that's someone that's just starting the job. If you thought entry wage was a lot, the median salary for a psychiatrist is over $70 an hour. That's over $150,000 a year. If that's still not enough for you, an experienced psychiatrist can easily earn over $200,000 a year. I personally think it's quite worth all the money put into school and everything.
As I promised, I will not go in depth on the differences between a psychiatrist and a psychologist. Firstly, psychologists only have a doctorate in their chosen field. Psychiatrists also spend very little time with their patients and treat their issues with psychopharmacology. Psychologists, on the other hand, use psychological assessment and psychotherapy to treat their patients.
In case you were wondering, psychologists make very little money compared to a psychiatrist. Annually, an experienced psychologist makes around $80,000 a year. If you remember, I said a psychiatrist that has been experienced for quite a while will easily make $200,000 a year. That is more than double the money.
I would like to apologize for not interviewing a psychiatrist. I could not find one nearby. However, I hope you enjoyed this documentary, and I also hope you learned quite a few things about a psychiatrist and its cousin career, psychologist. And also, I hope you learned more about how the human mind works and such. But now, I must wish you farewell.